I'm Gwenda Scott. I'm one of the public health strategists in Lewisham, and I'm working on the whole systems approach to obesity. And as you've heard already, that Lewisham was awarded national pilot status in 2016. And I think that what I wanted to say is that just to make it very clear that being a national pilot didn't bring about any extra funding. So it just meant that we were working with Leeds Beckett University, and so we have access to their support and access to their experts, but no additional funding, so we have to work with what we've got. And why did we think that we wanted to be a whole systems approach to obesity in Lewisham? And like most London boroughs, we have a very high level of childhood obesity, and this is the current picture of obesity in Lewisham as we presented it in our annual public health report last year. And 1 in 4 children in reception are overweight or obese, going to 2 in 5 by the time they leave primary school, and then 3 in 5 of our adults are overweight or obese. And actually putting it in this format has actually helped to engage people. They see the difference and they're worsening, so it's been quite an effective infographic way of showing the problem. We've used graphs and things in the past, and it's the same message, but this seems to be resonating with people. Lewisham is just a few miles down the road, and some of you hopefully have visited us, but we're a deprived borough. We're the 48th most deprived borough in England, and we've also a very diverse borough. We have over 130 languages spoken, and 46% of our population are from black and ethnic minority groups, and that goes up to 76% of our school population. And obviously, that brings along being a deprived borough means that our problems are higher. We're likely to have higher rates of obesity, but having the diverse population brings a lot of vibrancy and culture, traditions to the borough, but it also means that our population are a higher risk of some of the complications of obesity. And so we're very interested in having an impact on obesity. Right. No. So we have a high levels of obesity, and why we wanted to be a whole systems pilot and why we put our bid in, that we'd already identified that obesity was a strategic priority. It's one of our priority areas in our health and wellbeing strategy. It's also a priority area in our children and young people's plan. We have very good evidence of working in partnership in Lewisham, and we wanted to build on the borough's commitment to early intervention, prevention and community development approach. We have a very good models of working with our community, and we're using things like participatory budgeting, where we give local groups, very small pots of money to develop local initiatives to improve the health of our residents, and that's been evaluated and found to be very effective. So we had all that. We also had very resilient communities. We have hundreds of active voluntary community sector organisations and 200 individual faith groups. So that's nearly 1,000 groups are working in Lewisham. But we wanted to identify that we needed to have a more coordinated approach to bring all these people, our communities, together. Because even though sometimes they're working together, quite often people are doing small interventions that they don't share the practice, they don't share the learning, and working in silos. So we wanted to bring all those things together. So that's really the reason that we wanted to become a whole systems approach. So we wanted to maximise what we were doing and learn, to make effective use of the levers that the council could do to look at the impact on the wider determinants of obesity. So, as you know, we were chosen. What have we done in the last 18 months? And as all the London boroughs, we took part in a sector-led improvement exercise in 2016. I don't know if anybody else here was part of that programme. And so I'm sure our spider diagram, which shows what we our work around the 13 themes as part of the childhood obesity framework looked at, and it isn't much different to anybody else, but we had sort of looked at where we're at. We also looked at where we wanted to be in the future, and we've decided to use this framework as a baseline for our work to build our new obesity strategy. So what we've now done for our whole systems approach to obesity is that we've combined the areas of work that we're already doing, but we've reformatted them. And we've now got an obesity project board that was established over the last 18 months. So that's something that's happened as following being part of a national pilot. So we have senior officer representation from 3 of the 4 council directorates, and we didn't have that before. So we now have the executive director from community services, executive director of customer services, senior representation from the children's services, and an executive member from the CCG on our project board. And that has actually meant that we have very senior leadership buy-in for our obesity strategy. So even though we had it as a priority area before, it was mainly driven by public health, with either people volunteering to lead on certain areas. But now having the executive buy-in, it means that people are seeing it as more part of so it's not just the people who are interested in obesity are doing it, it's now becoming more core practice of everybody's workload. And visits by the Leeds team when we were part of the pilot, when they came and they interviewed all the senior leaders, and the briefings that came on helped to engage the wider representation of the council. So our overarching aims of our obesity action plan is to promote an environment that supports a healthy weight and well-being as the norm, supporting our communities and families to be healthier and more resilient, and to tackle the weight issues of those who are already overweight and obese. So those are our 3 main aims. And we're doing that by we've divided the work areas into 4 what we call priority areas. So that's children and young people, and there's a senior officer representation who leads on all of these. So we have regular meetings, we have exception reports, we have progress reports, and there is now a project board that's looking at this and making sure that if something is flagged as red, what can we do about it, and the way forward. So these are all the themes that were from the spider diagram that I mentioned earlier. We also, as Sam mentioned in her slides, and Sarah mentioned that we need to look at the wider partnership. So we did have quite a large partnership representation on working on our obesity strategy, but we realise we need to engage all of them and in a better way. And also try and align all the interventions together. So these are some of the partners, or the partners that we've decided that we needed to engage with, and ones that we've identified that we need to have better engagement with. So things like the food industry, local employers and colleges were ones that we've identified that we needed to focus on initially, because we didn't have such a good partnership approach with them. So what have been the specific things that have happened to Lewisham as part of the whole systems working that we wouldn't have done if we hadn't been part of the national pilot, but these things could be replicated anywhere, is that we've done a group model building exercise, and that was part of the areas where Sam identified is looking at what's happening, bringing partners together, looking at the causes and consequences of obesity, looking at what's happening and what more could be done. And that was very successful. We brought all the partners that we're currently working with, and actually it's surprising how many of them hadn't realised that the differences of the causes and the consequences, where they could have impact on. And end of that meeting, we formed our Lewisham Obesity Alliance. So all the people that came to our stakeholder meeting are now part of the Lewisham Obesity Alliance. We've got our next group model building exercise happening at the beginning of July. So people are coming along there. So we've talked about, we've identified key themes, and now we want to sort of develop actions, but also sort of see how we can align all those actions to have more of an impact. And as I've already mentioned, that sort of the senior management involvement has been greatly enhanced, as being part of the national pilot. As in the sort of discovery phase, we had to submit lots of information about what we were doing to Leeds Beckett, and they analysed all our policies, our action plans, our data collection, and it's good that sort of they actually sort of the feedback confirmed that sort of our way of working was going much more from the individual perspective to looking at the wider determinants. So it's good to sort of to be able to actually have that recognised and be able to show that work. The working with our stakeholders it's enabled us to have more facilitated conversations with different parts of the system, and we have realised that we need to feed back more. So even though we're working with people, people would share their experiences, and then sort of we'd hear nothing more, or a few of them would feed back to us. So we're working on how we can make that sort of system more fluid, so that people actually sort of say that they're going to do something, and then they can feed back to us, and we can sort of pull all these things together. And sort of we are starting to looking at sort of identifying the opportunities that we can to disrupt the existing system. And so it's really aligning all the actions around a goal. So we've got themes that we're going to be talking about in our next meeting in July, and we want to have sort of concrete actions that other people can sort of own and sort of build on. And Leeds are also going to be doing some research on culture and ethnographic research to us regarding attitudes to weight. So they're working with some of our community organisations. So that's just at the starting point. So, and as you remember, said that sort of we have a very diverse population. So they're going to be working with our Afro-Caribbean and African Black population to look at sort of the different cultures and their attitudes to weight. And obviously that information will be shared with everyone else once it's been done. All right. So the work in progress at the moment is a whole systems obesity is a key priority area for public health, and it's not just my area of work, it's actually become sort of a key area of work for the whole public health team, so we're all sort of contributing towards it. We're looking at sort of health in all policies approach. We're looking at how we consolidate new models of delivery, because even though obesity is a priority area, it hasn't meant that it's been sort of not affected by the cuts in public health spending, so we're looking at how we can maximise healthy weight outcomes in existing contracts. We're working very closely with sort of all departments and the STP about making every contact count and how we can maximise that, and sharing good practice. One of the things that we've got our obesity action plans, as you remember, we've got 4 priority areas. But what's different this time is that we've actually decided to have 3 key actions. We call them cross-cutting actions. So, and sort of a lot of the focus has been on these. So all the other things are happening in the background. But our 3 key actions are sugar smart. So we were the first London borough to become sugar smart, and we launched our campaign in October last year. So we now have coming up to nearly 50 premises that are signed up to Sugar Smart. So that goes from an individual childminding to sort of the NHS Trust, to GP practices, to restaurants. Millwall Football Club have introduced a levy on drinks that they're going to spend on sort of activities, healthy living activities for children. So we are finding that as one of the hooks on sort of actually getting our sort of partners engaged, and it seems to be very effective, because once you have that conversation about Sugar Smart, then they sort of see where they can fit in, and they do a lot more. It's also sort of, we have one of our councillors, or our cabinet member for health is a champion for Sugar Smart. So they're helping to promote the scheme. They're sort of putting on their Twitter account. So they're sort of engaged in that process. I'm sure that sort of quite a few other boroughs are doing the Daily Mile. I see some nods in the audience. So we started our Daily Mile scheme a few months ago. We've now got up to 16 schools in the borough taking part in the Daily Mile. And I think at the last count, we had 4,500 children who were participating in the Daily Mile every day. So I think that's something that doesn't need any funding. And schools have been very engaged. Once they are aware of what they don't need special facilities, and other schools are doing it, and it's very positive, and the feedback from the pupils and the parents have been very good at that as well. And the other one is our communities and how to improve access and appeal of parks for recreation. We're a very green borough. We've got lots of parks that have got the green flag, but we know that people aren't making access to it. So our local GP is developing an app for us to try and sort of help our communities to use the parks more effectively. So we've got a project board on that, and we're hoping to launch that in sort of beginning of July. So that, if that's successful, again, we can share that information with you. And I think what's useful is that sort of, with the Sugar Smart, and it's mentioned before, that we need to get the communities on board. So we did a questionnaire in our Lewisham Life, which is our local magazine that goes out to all families. We had a survey in there about sort of whether our residents thought we should be doing something about sugar before we launched the Sugar Smart campaign. And we had over 2,500 of our residents completed the questionnaire, back saying that very strongly agreed to us that we needed to take action. So that helps in sort of, so we're not saying we're doing it because of this. Actually, our residents want us to do something. And we shared sort of a good practice and learning. Our last annual public health report was on the whole systems obesity in Lewisham, and we made it a feature of sort of mainly case studies about sort of changing the local environment. So we had sort of, from nurseries to parks, schools, community groups, all gave examples of case studies of how they were making changes to in the environment. And that again helped to create, sort of, to get their involvement. And obviously once they've had their case study in the report, it meant that we could sort of go back to them and share that information. So that's again been sort of something that's been worthwhile. But what we're now looking at is how we can keep that regular communication with people about what's happening in Lewisham. So we're probably going to have a sort of regular newsletter and asking for feedback and communication. So fine things, our whole systems approach, I think it's been emphasised already. You need senior leadership buy-in to make any difference. And we need to build on the linkages and interactions. And we realise we need to have regular feedback to partners. And hopefully we'll be able to report back in the year's time and see what impact that has had on our obesity.